Mozambique is a southeast African country who's been hit hard by the AIDS-HIV epidemic. The first case of HIV and AIDS in Mozambique was officially notified in 1986. The first governmental reaction was in 1988 with the establishment of four sentimental surveys in Maputo, Beira, Chimoio, and Tete. These posts were established to monitor the evolution of the HIV/AIDS epidemic. In 2016, Mozambique had 83,000 new HIV infections and 62,000 AIDS related deaths. There were around 2.1 million people living with HIV in 2016, among whom 54% were accessing antiretroviral therapy. Among pregnant women living with HIV, 80% were accessing treatment to prevent transmission of HIV to their children. An estimated 13,000 children were newly infected with HIV due to mother to child transmission. According to UNAIDS, Mozambique's HIV prevalence stands at 12.5. One of the key populations most affected by HIV in Mozambique is the prisoners, with an HIV prevalence of 24%. Since 2010, new HIV infections have decreased by 24%, and AIDS related deaths have decreased by 46%. Other groups involving women aged 15 to 49 have an HIV prevalence rate of 15. Men aged 15 to 49 have an HIV prevalence rate of 9.9. Among young women, it is a 5.2, and young men, it is a 2.8. The government of Mozambique has been increasing interest in fighting the HIV/AIDS epidemic through different ways. In 1994, Mozambique signed the Paris Declaration, in which the signatory countries promised to fight HIV and AIDS, respect the rights, and reduce the discrimination of people living with the infection. The cost of organizations involved with HIV and AIDS shows that of the total amount spent in programs and projects, only 20% goes to the direct benefit of the people living with HIV and AIDS. 86% of the total amount spent on HIV and AIDS programs and projects is provided by international aid agencies, 11% of the Mozambique government, and only 3% by service providers. The government has scaled up prevention measures such as education on condom use. As a result of several multinational studies that have supported modes through which HIV infections can be reduced, such as the administration of ART medications to HIV positive breastfeeding mothers, the Mozambique government has been considering the implementation of policies to address these developments in HIV/AIDS research. Mozambique has some of the world's worst social indicators on children and adolescents, particularly girls, largely due to the limited access to resources and services as well as harmful sociocultural practices. More focus now needs to be placed on supporting adolescents, who are the fastest growing population group in Mozambique. An estimated 45% of the population is under 15 years old, and 52% is below 18. Child marriage puts many at risk for early pregnancy, violence, abuse, and neglect. Linked to this is the rate of early onset sexual intercourse, with 22% of girls and 17% of boys aged 15 to 19 years initiating sexual activity before the age of 15. The early onset of sexual intercourse has also contributed to the high level of HIV among adolescents. HIV stigma is a barrier to HIV testing and counseling, status disclosure, partner notification, and antiretroviral therapy access and adherence, and that moral stigma seems to be more common than physical stigma. Additionally, HIV stigma is a dynamic social process that is conceptualized as being tied to personal responsibility. To effectively diminish HIV stigma in Mozambique, future interventions should address moral stigma and reconceptualize HIV as a chronic disease. Unprotected heterosexual sex and vertical transmission are high known risk factors for HIV infection in Mozambique. About 450,000 Mozambique males are infected with HIV, and data supports that men are more likely than women to know of HIV transmission pathways and take measures to avoid infection. Women in Mozambique are less likely than men to understand transmission methods, which makes them more susceptible to infection. Several studies have shown that educating women not only reduces risky behavior, but also helps increase social and economic independence. With increased schooling and access to information, women would be more capable of informing themselves with information provided in HIV prevention campaigns. A huge percent of children in Mozambique are orphans due to AIDS. The government has begun administering antiretroviral drugs to promote early intervention in younger populations. One underlying reason behind adolescents, and especially adolescent girls, early introduction to and infection with HIV is the need to obtain money, to stay in school, and to purchase goods and foods in exchange for sex work. After malaria, HIV is a significant cause of child illnesses and death, which needs to be addressed at infancy through to adolescence. Adolescent girls are 3 times more likely to be infected with HIV than boys. Breastfeeding is also a major cause of vertical transmission in Mozambique, where replacement feeding is unaffordable for the vast majority of women and young girls. The social structure and organization vary greatly throughout Mozambique. For instance, polygamy in rural areas is believed to be a healthy practice, which provides an opportunity for a higher number of productive members within a household. However, should the polygamous husband die, the household falls apart, and the quality of life of the survivors may even be worse than that of a monogamous household. Some traditional beliefs can prevent people from using condoms, while other beliefs also prevent ill people from seeking hospital treatments or taking any kind of medicine, thus increasing the vulnerability of these people to infections and reducing their chance to overcome the effects of HIV and AIDS. The use of medicinal plants for the treatment of infections is among the most positive uses of local knowledge. The use of plants for treatments of various diseases is commonly controlled by the Association of Traditional Healers of Mozambique, which has also been in partnership with some HIV/AIDS projects and programs to help prevent contamination from sharing cutting objects, the distribution of condoms, and the use of medicinal plants for patients with scarce resources. Mozambique adopted the fast track targets in 2015, plans to extend antiretroviral therapy coverage to 81% of adults and 67% of children living with HIV by 2020. Plans are in place to revitalize HIV prevention, to identify gaps in the prevention of mother to child transmission of HIV cascade, and implement appropriate corrective actions. There are also plans to enhance male engagement in HIV services in hotspot areas and to scale up differentiated care models, including community service delivery.